A new report shows there have been shortages at many hospitals of a critical drug to treat the coronavirus. The FDA authorized Remdesivir for emergency use back in May. First on CBS This Morning, the consumer group Public Citizen says the Trump administration has mismanaged distribution of the drug to some states that needed it. Our consumer investigative correspondent Anna Werner has been looking into this.
My hands aren't able to move as well anymore. I don't know if you can see them.
34-year-old Michael Goldsmith still suffers the effects of his battle with COVID-19 that began in March. He spent nearly a month on a ventilator. His wife, Alana.
It was very scary, especially because I wasn't there with him.
Scary and frustrating because doctors had wanted to put her husband on the antiviral drug Remdesivir, but his applications to get it through compassionate use or a clinical trial were denied.
That was the lowest point of the entire ordeal, knowing that he needed this medicine and he could not get it.
More recently, hospitals have reported shortages of the drug, one that medical experts like Dr. Helen Boucher of Tufts Medical Center say can help shorten the course of treatment for a significant number of patients.
The longer they're in the hospital, especially in the ICU, the greater their risk of getting a secondary infection. And those can be very severe and even fatal. So anything we can do to prevent that risk is very important for every patient.
But consumer group Public Citizen found since July, at least 38 hospitals in 32 cities in 12 states have reported remdesivir shortages. And further, that states that had large epidemics with more new hospitalizations often received less remdesivir from the federal government. Public Citizen's Peter Maberduke.
The Trump administration assumed control of remdesivir allocations and distribution, and it's not going to the right places.
For example, the report says 1 week in July, Alabama, Florida, and Georgia reported the most new hospitalizations. Yet Ohio, despite having fewer new admissions and fewer total hospitalized patients, received far more remdesivir. Georgia got none.
You're basically saying the administration did not distribute this drug the way they had promised to. Why do you think that happened?
We can't know. We just know that the Trump administration, HHS, did not follow its own stated criteria to allocate remdesivir according to hospital burden.
HHS calls that a fundamental misunderstanding of its system. With a senior official telling us on background, the government has been able to fairly allocate distribution of enough medicine to treat 650,000 people in a fair and equitable process. In a statement, the White House said, anytime the Trump administration has had a request from a governor for increased supply of remdesivir, we have been able to meet those demands. But some Democratic senators have been asking questions about remdesivir since May, writing in letters to the administration that the remdesivir distribution plan appeared to be shrouded in secrecy. Maryland Senator Chris Van Hollen.
And have you gotten responses to either of your letters at this point?
No, we've not heard anything. I think it's an indication that the administration does not want to be transparent about its decision-making process, and that, of course, hurts all of us.
Maberduke says transparency is key, not just for this drug, but for future COVID-19 treatments or vaccines.
If we are facing this degree of irrationality, this degree of mismanagement today, these kinds of shortages, then what will happen when we have, hopefully, a safe and effective vaccine? We're going to have to do much, much better. If we run into a similar situation with a vaccine, many people are going to suffer.
Well, Public Citizen also outlines what it calls manufacturer Gilead Sciences' monopoly over the drug, saying that also has limited supply of remdesivir. Gilead, on its part, says that there is adequate supply in the U.S. to meet current demand, and that if hospitals don't have enough of the drug, they should talk to their state Department of Health. That's in part because HHS, Anthony, says that they allocate to the states, but then the states make the decision about which hospitals get this and how much.
All right, Anna Werner. Thank you, Anna.